Hello, my name's Carol Schillerbeer and I'm the Chief Executive of Powys Teaching Health Board, and I'm here just to share our Coronavirus COVID19 response plan with you. There are 5 parts to our plan. So the first part of our plan is in relation to staying at home and saving lives. The most important step in fighting the coronavirus, so COVID-19, is to reduce the spread of infection. By reducing our contact with other people, we stop that infection passing from person to person and stop the virus from transmitting. So it's really important that people can follow the government advice of social distancing, only going out of their home for the essential journeys and to pick up food and for medical appointments, and for that exercise once a day. It's really important that those in the more vulnerable category are shielded, and there is support for people in that category with their shopping and other actions to help them to stay at home. In relation to Action 2, that's about saving lives through self-care, family and community support. This is particularly important where we have vulnerable people in our communities that do need the help of family and friends and community members to support them to successfully shield and to self-isolate. This is so in relation to things like shopping and the provision of medicines, or even the keeping in touch and the befriending and enabling people to stay connected. This will help people who are on 12 weeks isolation to continue to feel part of the community, and for the community to help to look out for those individuals. And this is where the Powys Association of Voluntary Organisations and the Powys County Council, alongside the Health Board, will be working together to enable this support. The third element of the plan is to save lives through using the skills and resources in primary care. Primary care is often seen as general practice, but it also includes pharmacy, opticians and dental services. And there are some changes to these services to help us to respond to COVID-19, including the provision of telephone and online advice, only having face-to-face appointments when it's required, providing a rapid assessment when coronavirus is suspected, and there are going to be 3 or so hot assessment areas across Powys to assist in that rapid diagnosis for those with suspected COVID-19. The active monitoring of vulnerable patients, and we'll make sure that the referral routes for advice are clear between daytime and nighttime. Element 4 of the plan is around saving lives through the best use of our community services, including our community hospitals. We've been increasing our beds across our hospitals, and we hope to have up to 100 new beds in the hospitals over the coming weeks. This will provide a place particularly for people with COVID-19 to be cared for as close to home as possible, but where hospitalisation is required. We'll also be seeking to support people who may be sadly coming to the end of their lives. In terms of the community element, in addition to those types of services, we're also putting in place a rapid response service. That means that ideally within 2 hours, people in specific need will have that expert support and advice into their own homes. And then finally, the step 5 of our plan is the support from district general hospitals and specialist services. This means that those who need more critical care will be supported in the usual district general hospitals that they would go to normally. So working across Abergavenny, Hereford, Shrewsbury, Aberystwyth, Swansea and Merthyr means that people will have a district general hospital ready to accept them in the usual way. So this, take it all together, completes our 5-point plan for tackling the coronavirus. And I'm hugely grateful to everyone who has worked so hard in helping to prepare what we hope will be a really comprehensive response. Now, we couldn't have done this plan without the local authority and without the voluntary sector and other partners across, and we are working together to ensure that all parts of Powys can really deliver the very best for the people of Powys. So my huge thanks go to everyone who's been involved and in anticipating the weeks and months ahead. Thank you.